Well, a child with a sudden nosebleed, that can be so scary for the child and the parents, but they're pretty common for kids. They're usually harmless too. Most of us think we know how to stop a nosebleed, but we may be wrong. One of the most used techniques to stop one can cause more harm than good. With us now from Children's Hospital to explain is Dr. Ryan Redmond, who is the ER director. It's good to see you.
Thanks for having me.
Let's start with what not to do, since so many people make this mistake.
Usually the first thing that people have always heard is to tilt your head back and to hold your nose. And in reality, especially with the younger kids, that can sometimes lead to kind of bleeding down the back and then can actually cause more distress. So usually what you want to do is have them kind of lean forward. Still pinch the soft part of the nose, and the big key on that is you got to pinch that for a long time, really 10 minutes for each attempt, which is a lot longer than people think.
Yes, it is a lot longer, and that's tough to do with young kids. You just have to keep at it.
It is, and usually I recommend kind of actually looking at a watch or a clock, because it seems a lot longer than it is, and the temptation is to keep checking and let it go. Is it still bleeding? Let it go. Is it still bleeding?
But keep it there.
The key is you got to do it for 10 minutes solid and before you check.
Okay, very good. Let's remember that. Should a parent worry if the child has chronic nosebleeds, if this happens a lot?
Yeah, there are certainly other things that we think about with kids who have chronic nosebleeds or recurrent nosebleeds. Now, most of those things are just due to kind of local vessels that are fragile in that area, and oftentimes our ENT specialists can kind of help with that sort of thing. If there are other symptoms associated with it, with other sites of bruising, other sites of bleeding, those are the type of things that you do want to see your doctor about.
Oh, absolutely. So when do you see the ER? When do you go there?
So of course, if the bleeding won't stop, and we usually recommend 2 rounds of that 10 minutes. If the bleeding won't stop after that point, then sometimes we need to do additional things as far as packing and looking a little bit deeper.
Yeah, looking deeper. So what can these be a sign of if it's something that happens quite a bit?
So there can be problems with your clotting mechanism, so you can have problems with your platelets or the way that your blood forms clots. Again, most of the time that's not the issue. Most of the time it's just a local vessel issue in your nose. But those are the things you got to think about if these are frequent and recurrent.
You know, one last question. Sometimes there could be quite a bit of blood. It can be scary. Is that normal for
yes,
a typical nosebleed?
Yeah, absolutely. They can really freak everybody out, because, and especially with any kind of bleeding, you know, the amount that is on you know, pillows or Kleenexes, or, you know, people always, physicians, parents, everybody kind of always overestimates the amount of blood that's actually there. It always looks like a lot more than it is. So that you do want to give it some time to try and get better on its own. But again, if you're doing 2 rounds of the 10 minutes and it's not getting better, then that's the time to get seen.
Come see you. Yeah. All right, doctor, thank you so much. And if you have a question about your child's health you'd like for us to get answered for you, email me at ltucker@wate.com, and then tune in right here every Thursday at 4 to see if we answer your question on the air.